Welcome back to another sports massage therapy education video. Today we're going to be looking at shoulder mobility, following on from the video we've just done on the aptly scratch test. So if you haven't watched that and you want to know how to test for shoulder mobility, head over to that video which I'll link above. So we're always going to start off, you want to get some effleurage in there, make sure that the area is nice and warm before we do any deeper tissue work. And again, I mentioned this a few times, but always check for either heat to know that the area is ready, or alternatively erythema, so the skin is getting red from the blood coming to the surface. Okay, once you're happy that the area is nice and warm, we want to make sure we get a good amount of petrissage done to the area. We want to get as much mobility, elasticity in that muscle as possible. So I like to use a little bit of kneading. You can do a bit of ringing, although I find personally it's a little bit harder on this area. Maybe for the traps it could be quite good, but personally for this particular area I do like to do ringing. Always try and make sure as well you're working into the traps as you're going to do any kind of shoulder work. Reason being is obviously we don't just want to isolate the shoulder itself, we need to look at it as a whole and look at that whole shoulder girdle. So we're looking at everything that kind of attaches onto that as well. So really get in, work those shoulders, even get around that shoulder blade as well. So following that kind of medial border, I like to go in, use the side of my hand, just to really kind of loosen it off as much as we possibly can. Okay, so now that we've done the petrissage, what we want to understand is the structure of the shoulders. The first thing I'm going to look at is the actual muscles themselves in the deltoid. So we've got the posterior deltoid, obviously just at the back here. You've got the medial deltoid, and then just on that opposing side, you've got that frontal deltoid as well. So I'm just going to start with a bit of gentle stripping work. Nice, decent amount of pressure as we kind of push up through that area. And again, just to kind of add, this is just a general mobility session where I'm just kind of doing it more from a maintenance point of view. If the client has an injury or a specific problem, you're going to want to know your anatomy and know where to kind of look. So as an example, let's just say it was through retraction of the shoulder, then that's where your knowledge is going to come in. So what muscles are responsible for retraction compared to protraction? So then you would actually isolate which muscle was the problem. But for now, we're just doing a general kind of maintenance, just an overall, let's improve the mobility in that shoulder. So again, from here, we can now move into that medial. So I prefer kind of using the middle three fingers here. I like to really kind of just kind of follow it up until we kind of hit those bony landmarks and we know we're reaching the top end of that muscle. And again, from here, you can also get round onto the front there as well and hit that frontal deltoid. It's almost like you can kind of come into a bit of petrissage as well. You can bring that thumb into it. But you can see we're starting to get some really good colour on here now. And one thing you can do while we're here is I like to kind of just support the arm. You can just bring it through a little bit of movement as you're doing it. Perfect. And another little tip, whilst you're here, and it's just something I kind of like to do, you can bring that arm up, rest it on your shoulder if you need to. Just sometimes it can be a little bit more comfortable for you when you're actually working through those tissues there. Okay, moving back round to the shoulder blade now. What I'm going to get the client to do is just bring this arm up. Reason I do this is what that's going to do is bring the traps here into a nice relaxed position. So any kind of work I'm doing over the top of the traps is going to be a lot easier because there's going to be no tension through that muscle. So again, I'm going to find that kind of medial border. Obviously bear in mind, it's now going to have changed angle because they've brought their arm round. And I like to just kind of run all the way through. So just here, there's a little bit of a restriction there, a little adhesion. So again, what we can do, we'll go in, we can use that friction technique. It might be you want to go in, you might want to do a little transverse friction over it. You may want to do a trigger point. I think what I'm going to do here is a trigger point. So let's just quickly drop that 10-second test in. So I'm going to hold this down for 10 seconds. Let me know when I get to a 7, sorry. 7, okay, so we'll hold that for 10 seconds. To know if a trigger point is going to be effective, then we're going to just see if that number has gone down after those 10 seconds. Okay, so where are we now? About a 6, so it is going down. So I'm going to maintain this pressure now until we get to maybe around a 3 or a 4. And it's key just to make sure you maintain that communication with the client. So whereabouts are we now? About a 4. I'm going to give it a couple more seconds. I want to try and get this down to a 3 if possible. Okay, how about now? Okay, 2, perfect. So I'm going to apply pressure again now. Let me know when this gets back to a 7. 7. And again, I'm going to repeat this, because the idea is we want to try and get this number down as we've applied even more pressure now. And this is just my preferred way of doing trigger points. You can do the one where you kind of push down for 10, let off, push down for 10 and let off. It's completely up to you, but this is just my preferred method. So where's that feeling at the minute? Perfect, down to a 3. So then all I'm going to do is, yeah, much smoother through there. So going round, really just get in, loosening off around that scapula. Because again, obviously it plays a huge role in shoulder mobility. And again, we've got some really good colour coming through there now, so erythema is good. And then what we're going to look at now is looking at the chest as well and how that can also play a role in that shoulder mobility. Okay, so looking at the chest now, the key things I want to look for here is we're going to hit that pec major, but also the pec minor, because again, these all attach onto that kind of shoulder girdle, that coracoid process, with the pec major coming over onto the humerus. So, starting with the humerus, again, we're going to warm this up. I prefer to go across, but obviously always ask the client to bring a towel to a position they're comfortable with, only work within those boundaries. So I like to apply that pressure going out, following those fibres of the pec major. So they're going to come up onto the top of that humerus. And it's good just to really kind of get that in there, loosen off that tissue as best we can. And again, you can then start going in with the thumbs, feeling for any kind of tightness, anything that might be a bit abnormal, and then just focusing on those areas. Repeat this for as long as is necessary. One thing we can do is bring that arm round a little bit if we need to, get it supported on the bed. It just opens that up a little bit and allows us to really get in there. Looking at the pec minor, again, follow that clavicle just until we get to that acromion process, and just a little bit further over, you're going to feel that coracoid process like a little bony hook. I tend to come about an inch down from there. We can get onto that pec minor, and all I'm going to do is drop a little trigger point onto this. Let me know when that gets to a 7. And we're just going to hold. And again, same principle as before until that gets a little bit looser. So all we're going to do prior to that, measure underneath the shoulder. Is it slightly higher on one side compared to the other? Because that might be an indication of the restriction in that shoulder there, if there's more tightness in this area. Where are we at? 3. Perfect. So that came down really quick. So always look at the pec major and the pec minor when doing this. And the other thing you can do with the traps, again, I'll link the video above, but you can go back to the video I did on the neck. So one of the things I like to do with the neck, specifically with regards to shoulder mobility, I like to get in, obviously naturally just do your effleurage and stuff first, but I like to work the levator scapula. And I find a really good way is just following that neck down. There's like a little pocket you can just kind of get your thumb into. And I find you can just kind of really get in there, and I like to trigger point it. So follow the neck down, find that little pocket just kind of just below the traps there. If you can let me know when this gets to about a 7. Okay, so we're on that 7 now. So again, we'll trigger point as we have been before. I'll go with my preferred method, but again, go with what works for you. Let me know how we are now. Okay, so the number's going down, so we're at a 4, so I'm going to apply a tad more pressure. Let me know when we're back. Perfect. And again, we're just going to continue to hold, because the levator scapula coming down and attaching onto that scapula, it's all part of that shoulder girdle. If there's tightness here, it can restrict some of that mobility. Where are we at now? 4, perfect. So it's a nice one to really kind of do just to get down and release some of that tension through there as well. And then all we're going to do now is one final thing I like to look at with regards to shoulder mobility is actually the lats. So again, the lats come up, they're going to attach onto that humerus. If there is a tightness, whether it be from a postural issue, an injury, or just general kind of just tightness from maybe a busy day at work, it's all going to affect any mobility we have through the shoulder because it comes up and attaches onto here. And obviously if that's being pulled down out of alignment because of tightness, it's going to restrict movement in the shoulder. Okay, so for the lats now, obviously we're going to be pretty much coming from here all the way up onto that humerus. So again, always get it nice and warm. But I like to just, more so with this one, it's more I suppose of like a stretch technique. I like to get a good amount of pressure, really slow movement up onto that traps and then bring the palm of my hand into it as I get round to the top there. So again, nice and deep, following it round, getting up just in, applying that pressure with the palm as we come up into the point just there. And again, do this as many times as you need to. And again, forearms can work. So again, if I'm doing any kind of forearm work here, I always pivot my hand down to raise that elbow up because I don't want to be putting any pressure on the spine, especially those transverse processes. So you bring the elbow up, and again, nice and slow, bringing it round and just stretching through the tissues here. Obviously, if you do find anything, you find any adhesions, go into some of your advanced techniques to break them down. Frictions, it might be you want to try a trigger point, maybe a transverse friction. And then what we can do with the arm up in this position, another one we can do is actually just give it a little stretch and push that elbow all the way around until we get a nice stretch through the lats here. Again, when you need to, apply a little bit more. You can even do like a pin and stretch technique if you need to. It's like that soft tissue release. Pin an area, bring the arm up, go again, bringing it up and stretching through the tissue. Lastly now, one of the things I like to do, again, with any kind of shoulder mobility, is working the bicep and the tricep. So again, we're going to really get in there. How's that feel? Is that tight? Okay, so we'll go a little bit lighter with that one. Again, I'm going to bring this arm around a little bit. Always support this because you don't want them supporting it because all of a sudden this muscle then becomes tight where it's just under natural kind of tension. And again, what you can do, just give it a little rest on yourself there. Get in, do a little bit of kneading if you need to. Again, the other thing I showed earlier, we can do that as well. Placing it on your shoulder. Again, you just got to adapt your hand position slightly, but you can get in there and knead the area. But I like to give this one a nice little strip out. So let me know how that pressure is. How's that out of 10? 6. Okay, we're going to keep it around that. Just really work through those muscles. Because again, anything that attaches onto the shoulder could be a reason why there is lack of shoulder mobility. Doesn't always mean it's coming from a deltoid muscle. And again, as you're doing this, even whether it be general massage or not, you're going to notice areas where there's adhesions or tightness, which can help kind of lead to what some of those potential problems would be. One way as well now, to get to the tricep from this position, rather than flipping them over, get them to hold their opposite shoulder. And then what I'm going to do is walk around the other side. And what you can do as well now, is you can now get over and you can reach that tricep. And it saves having to constantly flip the client over. And again, similar things now. We're going to really get in, strip that out. Is that tight? And just focus on loosening it. Get your petrissage in there, effleurage, and just really apply all of the techniques that you've got in your arsenal to loosen it off as much as we can. And then at the end, all we would do is we would redo that aptly test to see if there's been improvement in that mobility. And if they have, brilliant, good job. If not, go back to the drawing board, maybe go back in, apply some deeper techniques, go for it again because, you know, we don't always get a fix first time, and then keep retesting, until you're happy with the results. And that is a wrap on another video. But before you go, did you know that 99% of you aren't actually subscribed to the channel? If you are enjoying the content and you want to continue learning more, please consider subscribing and don't forget to like and comment any videos you want to see in the future. And as always, I will see you in the next one.